Hello everyone. So we're finally here with the last chapter of the Intro to Psychology class. And we've already learned about psychological disorders, but we didn't talk about how we treat them and all the different types of therapy that are out there. So let's get right into it. So there's kind of two main types of therapy that we're going to be talking about. We're going to talk about psychotherapy, which looks at all the different, or a lot of the different fields of psychology and their form of therapy, and then this idea of a biomedical therapy. So the very first therapy we're going to talk about is the psychodynamic. And if you recall, the psychodynamic was based off of Freud, and it was this whole idea of the unconscious mind. So of course, psychodynamic therapy is then trying to tap into that unconscious mind, because the idea is that that's where the conflict is. It's these thoughts that we're not fully aware of that are pushed back into our unconscious, and so the therapy helps to bring that out. And so some of the techniques that are used are like free association, where you're just told to say what's on your mind, just anything, what's the first thing that pops into your head, just tell me, what you're thinking right now. And the whole idea is that, that taps into your unconscious mind. We also have dream analysis, which we've talked about before in this class, where it's just talking about what you dreamt about, and then the whole idea is that there's an underlying meaning to it. And then there's the use of interpretation. So again, the whole idea that, people behave a certain way or are thinking a certain way because it's representing something, deep, deep back in their unconscious. And of course, we've talked about Freud before, but the kind of Freudian views in the past were the whole idea that, all of these unconscious thoughts and desires trace back to your childhood, with the psychosexual stages of development. And, it was either this, aggression or sexual unconscious thoughts. And we now have more neo-Freudian views. And so there's a more modern psychodynamic therapy, where the idea is still kind of based on the idea of the unconscious, and that there's these thoughts kind of in the back of your mind, and it's bringing them to light. So it's this self-insight. And there's a greater emphasis on the present. So instead of thinking, that everything happened in childhood, and it's bringing that back, it's more looking at, okay, what's going on now? And again, it's more directly focused on different defense mechanisms. So, are you in denial? Are you projecting your feelings? Are you overcompensating? All of those kind of defense mechanisms is more the focus for modern day psychodynamic therapy. Then we get into the Humanistic Therapy. So again, that was like Carl Rogers and Maslow. And it was the whole idea of, bringing out your best possible self. It was very person-centered or client-centered. And the goal of the Humanistic Therapy was just being genuine to yourself. Like, who do you want to be? And, how can we get you there? Because a lot of times when people would seek therapy, it's because of, how they feel or where they are in their life doesn't match with, where they want to be. And so this therapy, it's non-directive, which means it's not just, them telling you exactly what you need to do. It's more talking through it and working through it together. And there's three main components to the Humanistic Therapy. You have unconditional positive regard. So regardless of what the person's like, regardless of what they say, just treating them with optimal positivity, making them really feel good about themselves. In a similar note, the next component is empathy. So again, understanding their feelings, being very subjective with their experiences, even if it's something that you don't agree with as the therapist, to still understand that, okay, this is really important to this person, or, they were feeling this way. And then the last one is genuineness. So being authentic, not only as the therapist, but as the client. Being true to who you are. Even if, there's certain aspects of you that you aren't happy with yet. Being honest about that is what you see in the humanistic therapies. And then we have Gestalt therapies. This is more direct. And a lot of it is kind of confronting what's going on in a kind of well, in a sense, it's confrontational without being confrontational. And what I mean by that is you're confronting your feelings, or, you're confronting feelings about certain people without them having to be right there in front of you. So you do role-playing, and then you do the empty chair technique. And so with role-playing, sometimes the client will start to play the role of the therapist talking to themselves. Or, if it's like a couples therapy, you play as the opposite person. And the idea is that when you're playing as the person that's, causing you distress, you start showing, what it is about that person. So it helps with the communication. And then in a similar light, the empty chair technique is when you just sit looking at an empty chair and you imagine yourself in that chair. And in a sense, you talk to yourself. But the whole idea is that you are confronting yourself. You're realizing, this is how I'm feeling about myself. It's kind of that Gestalt therapy. Then we have behavioral therapy. And if you recall, with the behavioral field of psychology, it's all about learned behaviors. And so behavior therapy is helping to stop those behaviors, to change those behaviors, to reteach or to teach better behaviors or more healthy behaviors. So we see certain techniques. So there's systematic desensitization. A lot of times what's done with this is a person is taught relaxation techniques whenever they're approaching a fear that they might have. So if there's someone who's scared of being in crowds, it's teaching them to, watch their breathing, practice this relaxation when they start to feel anxious. So, it teaches them to do these certain techniques so those fears don't go out of control. There's also aversive conditioning. This is tied to, we learned about earlier in this class, taste aversions, where you're associating some sort of a behavior that you want to change with something unpleasant. So a very common example is antabuse, which is a nausea-inducing drug, and this will be paired with whenever a individual consumes alcohol. So they have alcohol, and then this antabuse makes them feel sick. And the whole idea is that they, over time, will associate drinking alcohol with feeling sick, and then they won't want to drink the alcohol. So it's, learning through an association, which is, a huge part of behavioral psychology. We also have gradual exposure. So it's a whole idea. Again, this is kind of used more with facing fears and getting over fears, where you gradually expose yourself to what you're fearful of. So, if you're scared of spiders, you might see pictures of spiders first, or just talk about it. Then maybe, you'll be in the same room as a spider that's in a container. Things like that, just slowly but surely being exposed more and more until you can confront that fear. And then there's something known as cognitive behavioral therapy, which has that aspect of behavioral therapy, but it also combines cognitive therapy. And one main thing with cognitive behavioral therapy is this whole idea of the ABCs of rational emotional behavioral therapy. And this shows that what you're thinking about, how you interpret a situation, so your cognition, can affect, your behavior afterwards, or the consequence. So the ABCs, the A is the activating event. It's the thing that happened, that then results ultimately in C, the consequence. So, how you feel, how you behave, what happens because of that event. And what this model is showing is what you think about, the B, the belief about that event, can affect how you ultimately behave. So the example for this one is Harry asked Sally to the concert and was turned down. He was rejected. And so looking at the bottom one, there's the irrational beliefs, so the unhealthy cognitions, such as, it's terrible if I get turned down, oh man, I can't stand this, I'm so humiliated. And that results in a more, negative, emotional distress. So Harry's shocked, he's dejected, he's angry, he's depressed. But you can take that same event and have a different cognition, different belief of, she rejected me because, it wasn't going to work out. That's her loss, it's too bad, but you know what, I'll find someone who does want to go, and it'll be a better experience. Having that different cognition then results in a different emotional consequence, where Harry is somewhat annoyed and disappointed, but looking forward to the concert anyway. So again, it's the exact same event, but a very different consequence because of that different cognition, the different way of thinking. And so cognitive behavioral therapy, or more, especially this is the cognitive one, it's switching up how a person thinks, which then ultimately changes the way that they behave. Also in cognitive therapy, there's kind of two main things. You have Beck's cognitive therapies and Ellis's. And kind of the main difference is that Ellis's was more direct and somewhat confrontational, kind of just telling you what you need to do and how you need to think, don't think about it this way. The way that you're thinking about this event is irrational, and that's why you're behaving the way you are. Whereas Beck's therapy was more collaborative. It's like, okay, this is what happened. How else could we have viewed this situation? It's kind of working with the client as opposed to just telling them how it is. And then this is just kind of looking at the different therapies that we see of clinical psychologists. So you'll see the huge percentage is that cognitive therapy, but also another huge percentage is the behavioral. And then there's this thing known as eclectic or integrative therapy, and that just means that it's a combination. Because one thing to take away from the therapies is that there is not one form that works for everyone. Everyone's different, even just going back to cognitive therapy, some people respond better to someone telling them, the way you're thinking, is unhealthy, this is how you need to see it. As opposed to, other people, the more gentler approach works better. So having that eclectic or integrative technique for therapy can be very effective because you don't know the kind of clients that you're going to have. Continuing on, all of those therapies that we just talked about are usually kind of just for one individual. So one client, one psychiatrist, therapist, etc. But there's also group, family, and couple therapies where it is multiple people getting therapy at the same time. And a lot of times the focus of this is not changing, cognition, it's not changing behavior, it's looking at communication and problem solving. Because a lot of times if a family or a couple or a group are going to therapy, a lot of times what's going on is within that group or within that couple or within that family, there is a lack of communication or difficulty problem solving. So that's kind of the focus of these therapies. There's advantages because, of course, you can treat multiple clients at the same time. This also helps with addiction because, again, one thing that's really nice for treating with addiction is you can be around people who are going through something similar. And so you can relate to one another. And so if something works for one person, they can share their story. So that's kind of the group, family, and couple therapy. And then just looking at psychotherapy in general, and if it's effective, this graph might look a little misleading, but it's one of those things where even without therapy, you tend to see improvement over time, just naturally, even, with no therapy at all. After an event, a person tends to have like a huge emotional response to it, and then, it gradually declines. But we do see that those that are treated tend to have a better level of improvement than about 80% of untreated people. And that's what this graph is showing, essentially. So, long story short, yes, psychotherapy is effective. It's more effective to some than others, again, because everyone's different. Sometimes, you go to a therapist and it's not the right type of therapy for you. But it is found that overall, psychotherapy is effective. And this, again, is just kind of showing what types of certain psychological disorders or just, things that are going on in a person's life, the kind of therapies that you tend to see to help with those. And one thing that's often overlooked, slightly, there we go, often overlooked when dealing with therapies is this idea of multicultural issues. And I took an introduction to counseling when I was in college, and one of the very first things they tell you is that you have to be aware of a person's cultural background, because how you address them, how you speak to them, the kind of therapies that you use, a person's culture has a huge impact on, what works effectively. Like one thing that was brought up in the counseling class that I was in is there are some cultures where it's more of the emphasis is on, males, where the male is the head of the household, and that's just how it is in that culture. And so if you have an individual from that culture go and see a female therapist, it unfortunately might not work as effectively as if it was a male therapist. And so just being, again, and that's just one example, but being aware of a person's cultural background, if they're more hands-on as opposed to more hands-off. What's seen as normal. We talked about that in the last chapter. There's different ideas of a normal behavior versus an abnormal behavior in different cultures. So being aware of that is crucial when it comes to therapy. All right, and then these are kind of just all the different types of psychotherapies that we talked about, how long they tend to last, what the role is of the therapist, different techniques, etc. So now we're going to very quickly go into the biomedical therapies, because all of the ones that we just talked about are all psychotherapies that are looking into, the different fields of psychology that are out there. Biomedical, on the other hand, is more looking at the biology of it. And so one of them, and kind of the huge biomedical therapy out there, is drug therapy, where a lot of times you are diagnosed with a certain psychological disorder or certain ailment, and you are prescribed a medication for it. And so this and I'm going through it very, very briefly, but, there are anti-anxiety drugs that decrease anxiety. They can induce calmness or reduce muscle tension. So different medications, even though they might all be treating anxiety, they work in different ways. And then you can see some of the most commonly used ones. There's also antidepressants, that again, there's all kinds of different ones that act in different ways. Sometimes it's kind of more a mood elevator. Sometimes there's mood stabilizers. Sometimes there are inhibitors. They all act in different ways, and so it's finding what works for you. There's also antipsychotic drugs. These are used more, a lot of times for those suffering from schizophrenia to help with those positive symptoms. And again, positive doesn't mean good, it just means things that are added, that are beyond the normal. So having delusions, hallucinations, disorganized speech, disorganized behavior. It helps to eliminate or alleviate those. Another form of therapy is electroconvulsive therapy, or ECT. This is when an electrical current is passed through the right hemisphere of the brain, and it's kind of used as a last resort. It's not something that's going to be done, right off the bat. This is used more when everything else fails. Someone's at huge risk of, potential suicide. They're really suffering from depression, and so they use this as a last resort. The way that I best to describe this is if you've ever had a computer that's not working and, it's frozen, it's just constantly, it's not loading something, one of the very first things you do is you turn it off, you wait 10 seconds, you turn it back on. You do a reboot. And the whole idea is what's happening with the computer is there's a certain signal that's just not getting through because that computer's it's stuck in a loop. And so by just quickly turning it off and turning it back on, it helps to give the computer a way to kind of resend that signal. And that, though of course this is very, very not a most detailed explanation, but in a sense that's what ECT is doing, is it's kind of rebooting your brain, where there's this constant signal over and over again, and the right signal of, feel better, be happy, that sort of thing, is struggling to get through. And so they kind of do a reboot. Though of course it's not as severe as that sounds. And it is found to be somewhat effective. Again, it's used as the last resort, but you do tend to see that there's a relapse into depression symptoms for those that use ECT. So it doesn't seem to be a long-term, it's kind of a last resort, like this person needs help now, sort of thing. And then there's something known as psychosurgeries. These are very controversial. They were used far more in the past when there was something known as a prefrontal lobotomy, where they would essentially get an ice pick and they would stick it up your nose, and they would just hit that ice pick and kind of knock your prefrontal lobe a little bit. Not the most effective. You get giant bruising around your eyes. You don't see that anymore. But this is the whole idea that, again, if there's some sort of serious psychological disorder or someone is suffering from unbearable chronic pain, they will go in and really good example of psychotherapy is the cutting of the corpus callosum for those that have severe seizures. Would be an example of a psychotherapy. So again, it's not something that's done very often. It's done as a last resort. And it's a brain surgery. And then kind of last thing we're going to talk about is this idea towards community-based care. Because in the past, we had institutions. So there were psychiatric hospitals or psychiatric institutions. And there were a lot of issues with them in the past with treatment of patients. And so a lot of the institutions actually shut down. And so there's been this kind of question of, should we go back to that, or should the focus be more now on community-based care? And there are some drawbacks. Now that institutions have been closed down, I mean, some of them, not all, you see an increase in homelessness among the mentally ill. What ended up happening is a lot of people that were living in these institutes had, no family members that could, come and get them when the institutes were closing down, or no family members willing to come and get them. And so they were just, put on the street. And so you see a lot of the population of those that are living, or are homeless, I should say, tend to be seen as suffering from psychological disorders because they used to be living in these mental institutes that just shut down. Another kind of drawback is there's this whole idea of the revolving door treatment, where, a person is in psychological distress, they come in, they're treated for, maybe a week or so, and then they're released. And then, a couple weeks later, they're back. Because they're not staying there, because they're not institutionalized, you see this kind of relapse. So, I mean, there's positives and negatives to both sides. It's a huge controversy right now, but it's food for thought. And then you'll see, again, we kind of talked about it very, very briefly, but the different kind of drugs out there. And again, it's examples, the generic and brand name, what they tend to be used for, and then possible side effects or complications. And then there are some more. And that is it. And that is really it, because this is the last chapter. The only chapter that we did not cover in this class was chapter 12, which is social psychology, because it is such a huge field and such an important part of psychology that it gets its own class. But I will be doing my own kind of quick version of just a few of the things talked about in social psychology next week. But that is it for chapter 14. It's a somewhat short chapter talking about different therapies out there. And just one thing that I want to say, again, if you're in any sort of distress or, you're just not where you want to be mentally, physically, all of that, seek therapy. Therapy used to have this negative connotation to it that, if you seek therapy means there's something's wrong with you. No, that's not true. Everyone out there can benefit from therapy in some way, shape, or form. But if you do go out there and you try therapy and, you have a negative experience, try a different type of therapy. As we just learned, there's all sorts of different types of therapies out there. So, see what works for you. But people can benefit from therapy. It's a wonderful thing. But yeah, that's just what I wanted to say. And so that is it for chapter 14.